Okay. Hello, everyone. Go ahead.
Hi, everybody. Thanks for joining us today. I'm just gonna look here. I just need to clear up my screen. All right, well, I'm Marinette Smith. I'm one of the certified holistic cancer coaches through ecancer.org, and I have some other coaches with myself today, and we are excited to be able to bring you some information. So I am just going to read a disclaimer really quick that we can get that out of the way, and then I'll let Maya and Deborah introduce themselves to you. So we just want to let you know that this information, this discussion is for informational and educational purposes only, and it's not a substitute for professional medical advice, diagnosis, or treatment. The views expressed are based on our experiences and personal research. We are not your healthcare providers. So we always advise that you consult with your healthcare providers and their team and your team before making any health decisions or changes to your treatment plan. So before you decide to implement anything, just make sure that it's safe for you to do so. And then what we're going to do is we're going to have you guys leave comments and questions in the comments section. And what we would like for you to do is maybe even leave some topic suggestions, so that way we can continue conversations on what you are all interested in. And what we're going to do with the comments and questions is once a month we're going to go over those. So we'll have a meeting like this, and we'll just go over those comments and questions from you guys. All right, I'll let Deb and Maya introduce themselves.
Hi, everybody. Welcome to Cancer Conversations and Choices. My name is Deborah Herkey, and I'm a holistic cancer coach with beatcancer.org. I'm also an FNLP, which is a functional nutrition lifestyle practitioner. Welcome.
Hi, I'm Maya Saman. I'm also a holistic cancer coach with beatcancer.org and functional nutrition and lifestyle practitioner, like Deborah is. So we have decided to create this roundtable discussion and to discuss certain topics that you barely could hear in by speaking to your doctor, I would say, or your medical care team. Just bring the clarity for people to kind of take the action in their own hands, in their own health, when it comes to making, important decisions of their lives. Yep. Okay.
Yeah, so we're really just trying to provide you with as much information as you guys possibly can have, so that way you can make confident decisions in your health and your health care. So again, this isn't medical advice, but we do want to present you with information that is out there so that you can make your own decisions.
Right. You can take it home and do your own research before you make a decision and discuss it with your doctor. So whole purpose of this roundtable discussion, we decided to create this discussion so we can talk about it without any interruption, not to go off the topic, because I know people are interested and they were gonna, and people would put tons of questions, and it's gonna take us off our path what we would like to talk about. So we decided to talk about what we know, discuss between three of us, and then take the questions home and do our, and put like a question kind of once a month, answering the questions, whatever are going to be coming on the topics that we're going to be talking throughout the months. We're going to be meeting every Monday. We decided to meet every Monday. And if there's any interest, like a subject you have and you would like us to discuss, please make a comment in the comment section for us. Okay. Who would like to start?
Well, what are we talking about today? We've got some questions, or we're going to do some clarification, I think, on some mammogram topics, right?
Yes. Today's discussion is going to be about mammograms and what's the benefits of mammograms? Are the mammograms are really risky, or what the quality and survival rates of mammogram?
Mm-hmm. And this is such an interesting topic because there's so much information about it. And recently it's come to light, I think more to the general public, about some questions about mammograms and the safety of them and the efficacy of them, and are they really worth it? So hopefully we can provide a little bit of clarification on that today.
Right. Everything we're going to be talking about today, we will provide sources and details that you can take it home and look through yourself. And we just recently participated in Annie Appleseed project in Florida, where this topic also was discussed and presented by a few presenters, doctors, and medical team. And it sounded very interesting, and we would like just to share with people and what we learn and what we know, what we have been kind of following for, in my case, for a decade now. I've been knowing like the risk of mammogram, and I stopped having mammogram. I think I had 3 total, and I stopped having after I learned the risk of mammogram. So there's better options out there. And let's start with accuracy of mammogram. Okay. Let's
This is
discuss
fun.
about accuracy. This is very fun. Yeah. So
So
go ahead.
what's interesting for me is, so I'm a breast cancer survivor, and my grandmother had breast cancer. She passed away from a brain tumor. Actually, it was just a growth. So at the time, she was in Germany. So very interesting to find out, or lack of information that was coming out during that time. So I would say it was a brain tumor at that point. And she had passed away but she had breast cancer, never did anything about it. Old school Germany, don't open me up because then it'll spread type of, that's the way the way she felt. And then my mother developed a primary T-cell lymphoma. So very interesting, but that did take her life. So for me, it was a matter of just a matter of time for me. That's really kind of what I was thinking, but who knows what it was going to, how it was going to manifest itself. So when I was diagnosed, it was stage 1. And I had, because of my history with my grandmother and my mom, I had mammograms. I've had mammograms for, gosh, I think we were talking about, I think I had them for like the last 25 years, 20 years at least, 20 or 25 years for sure, every year. And it wasn't until the last maybe 4 or 5 years, I would say, oh, we need to do another one. Oh, we need to do another one. I'm like, okay. Kind of oblivious to, really what was going on. But I kind of thought, well, gosh, it seems like for me, it just seemed like a lot of radiation. But okay, that was the protocol. That's the protocol. That's what we have in our healthcare system right now is, you get a mammogram. And then if they see something or they're not sure, well, we're going to do another one. And then if they don't like that, or if they see something else, then they said, well, now we're going to do an ultrasound. Well, maybe we should have done an ultrasound to begin with. Because they kept telling me, well, we can see better with an ultrasound. Well, I'm going, well, geez, you gotta save my time and money if we could have just went straight to the ultrasound. But that's just, yeah, Maya, you had 3. I must have had 4,550.
I know, and I think I've had, because so after I got diagnosed with colon cancer, then it was found, I have a high risk for breast cancer in my family. Breast cancer in my family. So I started getting screened, at the age of 30, and I'm 43 now. So that's 13 years of mammograms, some of them were more than 1 a year. And then this last time I had kind of like what was going on with you, Deb. So because the tech was new, they were wanting to do even more imaging. So that meant like putting me through more radiation, which to me was not like the best thing to do. I mean, like that's not safe for me as a patient. So yeah, it's I think in sometimes in the medical world, you just kind of see it as like, oh, well, we still need to get the imaging done. That's okay that if they have a little bit more radiation. But I think it depends on too where you're at. But yeah, I was just kind of shocked. And then they're like, I told them even at the very beginning, like, you're gonna have to just do an ultrasound. What ended up having to happen? Yep, had to have an ultrasound. Yep, had to have some other things done. But really, if you would have just done the ultrasound probably in the first place, I wouldn't have had to have the mammograms. So yeah, it's just interesting how that always happens. It's like you just kind of got to keep going with it, but you really don't have to. You can stand up for yourself. You can advocate for yourself.
Right. When we were listening, Dr. Jen Simmons' presentation at Annie Appleseed, she was talking about how in the entire system, entire industry, being in medical school, they basically drill in your brain. This is a procedure you have to have, like this is the steps you have to take, and this is a procedure. And after that, in the residency, they also drill in the brain. And no doctor ever questioned. They think, okay, the smart brains, the scientists had done their research, and they're teaching now the students, and no one ever questions, like, is that the right way of approaching the cases? But it's been in Europe, in Switzerland, or UK, and other countries nowadays, it's been they've been following the steps of the mammogram accuracy, and the way it comes out, they're actually about 52%, if I'm not mistaken, 52% of people being misdiagnosed. Actually, it's like 37% of overdiagnosing people, and adding DICU, ductal carcinoma in situ, which does not consider to be cancer, into that 37%, it makes it 52% of people are getting misdiagnosed with cancer. And actually, what is it, like about 8 out of 122 people are gonna get severe form of cancer, 8 out of 122. And this is we're going to be putting these links here. I can share my screen and share the links just briefly on the screen, but all the links are going to be added into after our summary. And we're going to be posting this video on YouTube, so it's going to be added there. We'll share the links for you to learn about it. And by talking about it, 52% of overdiagnosing, that's mean it's increase of cases of mastectomies, because mastectomies before, they used to offer to a female if there's any sort of like if it's aggressive cancer, a later stage. But now more and more we're working with clients, and we see more and more people are coming to us with stage 1. There's a little tumor in their breast, and they're getting offered the doing a double mastectomy to prevent cancer. So, and no one talks about complications of those mastectomies afterwards, and living the rest of your life with mastectomy, which is going to be probably our next topic, our next roundtable. So I'm a cancer survivor, I'm breast cancer survivor myself, and it's been a decade now. No, it's been since 2009, my first diagnosis, and 10 years after my second diagnosis. So breast cancer has been kind of leading cause in the female death, and knowingly that about 52% of people getting overdiagnosed. That means they're having unnecessary treatments when it comes to chemotherapy and radiation. And some studies in Norway and Switzerland has been showing that certain percentage of females, they go through unnecessary like chemotherapies, radiation and mastectomies, and getting overtoxicating, and their life getting shortened because of those treatments, where they could just like adding on additional because of the mammogram, misdiagnosis. That is something I think we have to look into that. And just one second. So when we talk about mammogram being accurate, since I would say late 90s in Europe, there was a lot of questions how accurate it, because doctors start seeing the differences between accuracy of mammogram and accuracy of other procedures such as ultrasound and MRI, or 3D ultrasounds or 3D mammogram. Now they have a 3D mammogram. I never have heard about, I mean, I have heard about it, but I never had, I did not go for it. So, considering, yeah, right.
Like most insurances don't cover a lot of the 3D.
Right. Yeah, 3D. Taylor. Yeah, and then so other things are biopsies. So when people mammogram, if it shows something, that's one of the things. So the doctor would send a patient, a female, for an ultrasound. So interestingly, I asked ChatGPT actually, why mammogram, not ultrasound? They said it's a standard procedure of the system. The mammogram, this is ChatGPT replies to that. So the mammogram is a standard procedure, And if there's something suspicious, the doctor would send patients for an ultrasound. So basically, if something's suspicious and the ultrasound shows more in depth and gives more clarity to the after the mammogram. So the question I asked ChatGPT, why not ultrasound in the first place? If ultrasound shows more clarity and more define if there's a tumor or not. Of course, I don't want to go in depth in that because of the financial issues, because it makes more money for the system. But it's just the other thing is putting a lot of pressure on the female breast. I think it's about 45 pounds pressing on the female breast, and it's such a sensitive top place of the
Feels like
female
1,000.
body. Feels like 1,000, and for everyone who had ever had a mammogram, you know how does it feel. 45 pounds on the sensitive area. What do we have? Those, the tissue, such a soft, gentle tissue, then that is being pressed down. And some researchers has been some studies have been shown when they put such a high pressure on the breast and it has a small tumor in it, it would burst the tumor and kind of promote the spreading of cancer, more in depth. And then after that, when they send female for an ultrasound and do a biopsy, that's another thing. By poking a biopsy, because we know all tumor usually is very, isolated. When it starts off, it's very isolated form and it's covered with certain protein layer, so it won't spread. That it's a innate ability function of our body protecting itself, not letting the tumor grow outside that area when it starts developing. And except the lymphomas and blood tumors. When radiologist goes with a needle and pokes the tumor, and it goes in and out and try to take multiple biopsies from different spots, so it goes into the tumor from different angles and causes the and it causes the leakage. It's very questionable, like and some doctors do talk it spreads cancer. Some said it doesn't spread significantly. Again, I leave it to a person themselves, like to make the judgment and to go for biopsy or not to go for biopsy. But some doctors do talk about the cancer grows faster and metastasis happens faster than not having a biopsy. But
that probably really points into like each person's makeup and their background and their history and their environmental exposures on what decision they're going to go with that, probably, I would think. Yeah, like if they're going to do a biopsy, even a mammogram.
Well, I think doing a biopsy, I mean, obviously they need to know what they're working with, right? They're not going to know until they actually do a biopsy. I mean, and that thought has crossed my mind too, because I still think my grandmother, well, if they go in there, then it's going to spread it. But I mean, again, I guess I haven't read any reports on that. I mean, that's something that in my research and everything, I have not come across that. So if anybody else has, I really, really would like to know, to actually to share with that with everyone as well, because I haven't read anything with that. And one of the other thing too is we talk about you're talking about how it's protocol. And even, with me, it was like, well, that's protocol. You do a mammogram, and then if they need to, then they'll do an ultrasound and whatnot. And they just want to get the, just a quick snapshot of it. So there's two things here. The other thing is, thermographic imaging is huge. You can find out whether your tissue is changing 8 to 10 years prior to the tumor even forming, which is, well, frankly, I wish I'd done that since I've had so many in the last 25 years. It would have been really nice to have seen that, to have known that. But I have known really what to do with that information at that time. Without knowing what I know now, I don't know. I wouldn't have known what to do. But it certainly isn't, something that is talked about or made available, as much as certainly not back then. And now completely different story. And but the one thing is when going back to protocol, the MQSA, which is the it's a Mammography Quality Standards Act, and the FDA regulate mammography to ensure quality and safety, which requires facilities to notify patients about their breast density. Now, I thought this was kind of interesting. Yes, so there is actually, and you can look that up. It's an MQSA program. So there are regulations, but it's the FDA that's regulating it. And it was enacted in 1992. Well, how long have we been having mammograms?
Right.
So, right. So, and that ensures that, and it's that that program, the MQSA, actually ensures that all women have access to quality mammography for early breast cancer detection. So, of course, I question all. I hope that all women are able to do that of all demographics. Again, I'm not sure if if we actually are allowing that to happen, or if that's happening everywhere. And then the FDA, along with some FDA-approved state certifying agencies, certify facilities to perform mammography.
Right.
So they have to. And on this website, there's websites. If you go to the website, you can actually see which facilities have lost their over the years, which facilities have lost their certification to actually provide mammographies, which ones have gone wrong, that type of thing. And so it's very interesting. It's out there, but it's certainly something that is not really made readily made available to all of us. Facilities have to display their MQSA certification, so you can look at that. There's been updates. In 2023, the FDA published a final rule amending MQSA regulations, with facilities having 18 months to implement the changes. So again, in September of 24, they updated the rule again, requesting facilities to notify patients about their breast density. And I thought, well, that's why I'm getting this sheet of paper every time I go in now, and with a picture, and it says, oh, you have this, you have that, and here's a picture of your breast density and that kind of thing. Whether it is, and they have to tell you whether it is dense or not dense. So that's something that they're regulating. They also require facilities to inform patients about the risk of breast density tissue and the potential for supplemental imaging. No one's ever told me about that.
Right.
So next time, because I go in for checks still every year since last year, but they also are urging people to discuss their situation with their healthcare provider. I mean, that's huge. And to do that. And I'm really curious to see what reaction or that the healthcare provider actually provides you. Dense breast tissue can also make it harder to find breast cancer on a mammogram, and also increases the risk of developing breast cancer. In some cases, there are other image testing in addition to a mammogram may help find cancers in women with dense breast tissue. That being said, I think thermography might actually be a really good one as well. Just a complete suggestion on that. Let's see. Potential harms and benefits of mammograms. Obviously, according to this site, potential harms include false positive results, overdiagnosis, and radiation exposure. They don't go into how much of that radiation exposure, which I think is interesting. So would be to delve into that a whole lot more. Benefits include early detection of breast cancer. No doubt about that. Of course, it did with me. They said I'm a poster child. Yeah, well, I'm a poster child. I come every year, but yet now you see a tumor. So what happened last year? Did we miss it? Not sure. Yeah, exactly. That's what we get there.
Right. Just to back you up, Deb, here I pulled it up from this women's clinic imaging. The reason I pulled this up just for people to see the clarity of breast density, because when people are who have a higher breast density, so their risk of getting cancer is higher, and not being diagnosed is also higher, because this is a normal breast tissue here, which is fat tissue, mostly fat. This is mixed fibrogen and a fat, and this is more fibrogen, dense, and here is extremely dense breast. It's very hard to see a small lump in that, on the mammogram when it comes to breast density. That's why people who have breast density, you have to question your doctor. You have to push your doctor to do a further, investigation, just to be clear if there's nothing under that dense breast.
Absolutely.
And I think a lot
Absolutely.
of that is actually in policy now in most healthcare facilities. If they do find dense breast tissue or see any type of abnormality, which could even be a cyst, they do automatically, I think, a lot of them do have you follow up with ultrasound imaging.
I was going to say that's where the ultrasound
Right?
comes in.
Yeah,
Right.
yeah. But then it's
So,
interesting to me when you're
yeah.
saying that you can't really see sometimes the tumors anyways, the dense tissue. Why are you getting the mammogram?
Right.
so
Right.
yeah, the
Exactly.
mammogram won't detect tumor, a size of a tumor like 2 to 3 centimeters, even 4 centimeters, if there's a dense breast. That's pretty large tumor,
Pretty
like
significant.
pretty significant to not to get detected by mammogram. It's one thing, and the other thing are in females, they sometimes they would send for ultrasound to detect it. Ultrasound also has to be in depth, check. MRI is another one to check. So a lot of females, they might keep growing tumor and keep having mammogram and having the same breast density, breast density, and over every year they would say no changes, no changes, no changes. And then at the same time, the tumor kept growing. In the mammogram, the other question is mammogram, is it really early detection of the cancer? That's another question. The doctors from all over the world been questioning at this point, because when the mammogram picks up the cancer, it's already sitting in your body from 2 to 7 years. Is it really early detection? That's another way of
Exactly,
looking at
right?
mammogram,
So
right?
the USPSTF, which is the US Preventative Task Force, they recommend that biennial, every other year, screening for a mammogram for women ages 40 to 74, every other year. But they also say they conclude that the current evidence is insufficient to assess the balance of benefits and harms of screening mammography in women 75 years or older. And I'm thinking, well, what's the difference between a 40-year-old and 74 years? That's just my question. I'm just like, oh, because before that it works okay, or we know what that is. And who must meet MQSA requirements? All mammography facilities must comply with the requirements, except those under the Department of Veterans Affairs.
Yeah.
So kind of interesting. So everybody has to, all facilities must comply with these requirements except for VA.
Females, like when they postmenopausal females, their density of their breasts would change. Older female gets, the density of the breast changes. So elderly people fall into being misdiagnosed more than the younger generation. And there's some studies have been showing, I can share those studies like on my screen, just to be fair. Where am I here? I have a little note here, right here. Oops. So what it shows, we'll put all these links in the description later. So studies adds on to debate about mammography in elderly people. So apparently elderly people have been misdiagnosed and having mastectomies and chemotherapies over nothing. And many cancers would not even turn into the life-threatening cancer or conditions to have any sort of treatment by what I want to say, sorry, any sort of, like, the cancer is not going to move to a next level. The people could live and not die from cancer. They might die from something else, but not from cancer. But the action that would be taken toward those females are very harsh. Mastectomies, chemotherapies, radiations, it causes like damage, and people get intoxicated, and it basically shortened their life. Yeah.
So
Another.
what was that I was reading that from that other study? Well, it was a review of studies that I had sent you guys. Let's see here. It says, I'll share this too, but mammography decreases the number of women who will die. Let's see here. It says for every 10,000 women who get regular mammograms for the next 10 years, the numbers whose lives will be saved because of the mammogram by age group is approximately 5 out of 10,000 women, age 40 to 49, 10 out of 10,000 women aged 50 to 59, and 42 out of 10,000 women aged 60 to 69. So those numbers, it's like, I mean, is it really making that big of a difference, or is it not? Like, are those people really, you know, would they have been worse off or not? I mean, or not? Because it's just so hard to say. There's so many different variables that are playing into all of this. And like Deb was saying too, like it takes a while for those cancers usually to grow. Most are not aggressive at first, but it takes a while for them to grow. So yeah, it's just it's just amazing to me.
So if it's
small, found that small, why don't they just keep an eye on it or try other alternatives?
So exactly. So if mine had been with me for 2 to 5 years, I never noticed it, you know. And I went in for a annual physical. My doctor didn't catch it either, the breast exam and everything, and she didn't catch it. You know, the first thing I you know, once at that clinic in that hospital, once they said, oh, well, we're pretty sure that you have this. And I said, well, how do you know unless you actually do another, you know, a biopsy or whatever, you know. Obviously they do this all the time, but I was going to go to a bigger hospital, one that does this all the time, every day, in Seattle. And so that's what I did. And within 5 minutes, 10 minutes being there, she's like, yep, here it is. Like,
Yeah.
you know, really, I was like, she goes, do you want to feel it? Well, no, I don't. But I said, yes, I do. Yes, I want to know.
Yeah.
I want to know. And I was just amazed. I was just like, God. And I said, you know, if I'm a poster child, I've failed because it's already there. I can already feel it. So if it's already been there 2 to 5 years, and I have dense breasts, and by the way, my insurance does cover it, so I think it is it's insurance dependent. If I had had an ultrasound, would it have caught it? You know, a whole year, 2 years prior to that, and then thermography. You know, I'm throwing that back in there again. Would it even have noticed the changing cells 8 to 10 years ago? 8 years ago, 5 years ago, even, which, you know, would have prompted me to do other things. So look at other avenues, that kind of thing. At least bring those images to my healthcare provider and say, look, this is what I've got going on. You know, and I think that's important to do. I know a lot of people feel uncomfortable about doing that, but hey, this is your life.
Yes.
And so 6 months.
Yes, exactly.
6 months ago, I went in and had my annual mammogram because I try to be, you know. So I went in, of course, it came back. I've always had dense breasts, but it came back, you need an ultrasound. We're gonna retake the mammogram and then give you an ultrasound. I'm like, just for the right breast. I'm like, all right. And then you've got a mass behind your right nipple. There's something there. And so I didn't hear anything from my doctor until, I don't know, it was about a week later. They did call, but then they said, we're going to let it sit for 6 months. And I'm like, oh, okay. You're going to let it sit for 6 months. That's fine with me.
Stew for 6 months.
I'm in you know, I'm 66. I live in the goiter belt. So I'm like, well, screw you guys. So I started doing castor oil packs on my breasts, upped my iodine, and dropped my diet down to 20 carbs. Well, and that wasn't, you know, like every day, but I mean, I really reduced my carbs. You know, I'm like, screw this, it's gone. And I went back and had to have another mammogram and another ultrasound. And now it's just, you have some areas of dense tissue. Okay, right nipple's good. You know what I mean? It's like everything. And so I'm like, why do you have to go through all that? I didn't understand the whole thing about the mammogram. If you always have to have an ultrasound, just do an ultrasound.
Yeah.
You know,
that's a biggest scam. That's the biggest scam I think we have nowadays in our system, unfortunately. And the other thing is in the book, which I didn't read, I'm planning on getting Ben Johnson book, Dr. Ben Johnson book, he wrote about mammogram, rethinking screening of a mammogram. He states that exposure to radiation and that small part of your breast, it's 100 times of the X-ray exposure of your entire body, because you're getting such a high exposure being on such a small location area of your body, and it hits it. And if you're going for mammogram like over and over, So it's about increases the risk of cancer by 2% every time when you go to. So 10 mammograms is 20% increases the risk of, getting breast cancer. And even though CDC and WHO would deny everything like that, of course, but we have to be wise when it comes to our own body and our own health, right? We have to make decision. What do we want for ourselves? We have to make that decision, and we have to, because we are hiring a system, to help us to take care of ourselves. It's not the system is hiring us and tell us what to do with our own body.
I was actually going to really bring that up because working as a nurse, I can tell you that there are certain processes, certain insurance companies do expect you to walk through before they will even cover anything. So you have to do the mammogram first, then the ultrasound, then what other testing, because it is dictated by insurance. And so you can fight that. You can't fight it yourself. You can provide them with the studies. You can provide them with your own medical, background. You can provide it with your concerns and see if they will waive that. But it takes a lot of work. So I think it is important for us to be able to keep spreading the word. So then that way, those systems change, because until somebody says anything, it's just going to continue to stay the same.
Right. Someone I know told me once when we were talking about mammogram and the pain and screening and excuse me, and having gosh, sorry. So anyhow, speaking about mammogram, the risk of mammogram, when her doctor told her to have a mammogram, and he was pushing her to have a mammogram, she told him, you know what, when you go and have your balls squeezed as much as we have our breasts squeezed, then I'll go for mammogram. So we, it sounded so funny.
Can you feel our pain?
Exactly, feel our pain. So it was funny at the time, but then down the road, when you think about it, that's exactly what we're experiencing. We're experiencing a lot of pain, discomfort, exposure to radiation, and and higher risk of, developing cancer. And do we really have to go through that? That's the question we have to ask ourselves. I am going to share a video, which is a great video, in the chat here, and I highly recommend everyone to watch this video. It's on Rumble. It's called "Boobs: The War on the Woman's Breast." It's a great documentary. It's about doctors and researchers from many countries that coming together and bringing awareness about mammogram and danger of mammogram, and is it really accurate, and what's the accuracy of it. So if it's like 52% misdiagnosing people, 52%, this is over 1 million people throughout the time, the many years that has been misdiagnosed, mistreated, and probably most likely died an early death just by having a mammogram. So we have to think about that. We have to think, and we have to question everything that we are putting our body through, and what we're putting in our body, So that would be the awareness. There's a lot of research is available out there. Before you do anything, you can contact us if you need any researches, any papers. We can always provide them to you, because that's what we do. We question everything before, like I question everything before I would try and test it on myself. I've learned hard ways, and that's, we are here, like 3 of us who went through cancer, and we know challenges of chemotherapy, we know challenges of surgeries, mastectomies, and pain and everything. And we just would like to bring this awareness to females. You don't have to go through what we went through.
Yeah, that's so big. What was Dr. Simmons saying, that the psychological stress that it puts on women, even just going to get the mammogram done, is significant? And even if you decrease that stress, it would probably be better for them than going to get the mammogram. Is that how she worded that?
Yes.
Yeah. Okay.
Yes. And I think even after, I mean, when I walk into that hospital for checkups and whatnot, I mean, there's just like some serious PTBD going on. That's post-traumatic disorder, man. I'm telling you, it is. Yeah, it's a lot. It's a lot. It's not just the physical, but the mental that you go through, emotional, is significant. But that's
Then
a
I
whole
think
other
it sits in the
topic.
back of your head. Like, once somebody has kind of already said that, or even like suggested it, or you're at the age where you need to start supposedly going to get mammograms, for what they found. But like that is stressful because it's always kind of sitting in the back of your head. And then if you have family members that have had, the same that type of illness or disease, or have even passed away from it, it sits even more in the back of your head. So you're creating a thought in there that shouldn't even be
Mm-hmm.
there in the first place. And it's just still
Right.
hanging out in there. So how do you not know that that's not hanging out and then creating issues in your body?
Right. Well, right. Yeah. Then I know I had brought this up with a conversation that we had before earlier on a different date and stuff. And that was the comedian who just recently had a little boy, and also and like 15 hours prior was diagnosed with breast cancer. And she's, she's a comedian and she's making light of it. She goes, "My gosh, my son saved my life, because without, having him and being in the hospital and everything that with the breastfeeding and everything else there," she says, "I don't think it would have been discovered." Well, they told her, said, "Well, it's a 0, it's stage 0." So, and she's like, "Oh, thank goodness," and she's not telling everybody, "It's just a little breast cancer, no big deal. It's okay." But then at the very end of the article and everything, as I'm reading this stuff, it says the doctors have recommended that she have full double mastectomy right away. I'm sorry,
Yeah.
what? How does it go from being stage 0? Granted, I don't know the biopsy, or if she's even had a biopsy yet, or even what that has come out. Definite. But anyway, I just was floored. I'm like, oh yeah, so we'll just lop them
Yeah.
off. Just take them both off.
Because
No.
lumpectomy
It's
is
no
not
big deal.
gonna lumpectomy is not gonna make money. It's not. But when
No,
it comes to
they said
mastectomy,
mastectomy. They said, well, yeah, full double
that's what I'm
mastectomy
saying.
for her. And I thought, she's
Exactly. The lumpectomy is not gonna make
36 years
money.
old.
But mastectomy and then reconstructive surgery is gonna make system more money. That's what people have been facing. And I do see from my clients that I work with, they come to me, they would say, "Oh," and I would question, "Why not lumpectomy, stage 1?" They would say, "Oh, my doctor just said as a preventative." Okay. So as a preventative, having mastectomy or one side or double mastectomy, this is just crazy.
Or a lumpectomy, and then you have to have chemo and radiation. Okay,
Yes.
so, and then if I have a
Body?
mastectomy, then you don't have to do anything and you're good. So what do you mean by I'm good? And then I'm not sure which is the lesser of two evils, chemo and radiation, or just lopping it off and just hope for the best kind of thing, and it's so important we do our due diligence to really do the research and bring these questions up to our doctors, because it just floored me when reading that article where it said that the doctor has said, yeah, you informed that she needs to have a double mastectomy right away. She's 36 years old, for crying out loud. I'm like, I don't know where in any of these, the USPTF and the MQSA program where the standards are 36 years old, but she's not supposed to get a mammogram until she's 40.
Yeah, I just don't understand that. Well, plus like the stress of all of that surgery. Surgery is super stressful
It just
on your
doesn't
body.
make sense.
Very stressful. And one more important part, actually, I wanna bring it up, is who reads your slides. Your radiology who reads the slide, they might be wrong. You have to take those slides and you gotta go to different doctors, 2 or 3 or 4. It doesn't matter. Unless you see everyone is saying the same thing, then it's a different story. But everyone, if all 3 radiologists or, doctors are talking about different, different outcome, then you gotta question. You have to question that, because those radiologists might make mistakes. The doctor, your gynecologist or your doctor who received the results makes could go on with the flow, just saying, "Oh, there's abnormal result, then you gotta go see the surgeon, you gotta go see that." It all depends, who you're working with. That's why we always push this, go get your second opinion, go get your third opinion. It's very, very important. And don't take a paper that is a result of radiology impression of that reading. take the slides to a new doctor, let that doctor read those slides over, because it depends. It depends like who reads it, who reads your slides, how they interpret your slide. It's so important that because of the misdiagnosis, 52%, that's such a huge number of misdiagnosing. It's
It's
overdiagnosing.
huge. It really
It's
is.
huge.
Can I bring
It's
something
huge.
up too? This is outside of mammography, but this is just an important part of like imaging in general. So I was diagnosed colon cancer 10 years ago. I think it was 8 or 9 images prior to that official diagnosis when I had my colonoscopy. You should have been able to see it. If I would have taken those imaging to people when I knew I was having problems, issues, and I was not getting answers, if I would have taken that to somebody else, I may have been able to find the cancers. Like the cancer could have been sooner, like and addressed sooner than to the
Yeah.
point where I was like losing my life. So like it's really important to go get those other opinions, to do your other research because it's your life that's on the line, not theirs. It's not whoever you're going to see. It's all about you. So you
It
never
is.
know what's going to show up.
I have
And
a
that's
crazy-
huge. And the
Yeah.
one thing about that too, and I know is bringing up the cost, right? Being able to go someplace and having another, you know, whether it be thermographic or another, or going to have an ultrasound done, bypassing the mammography and just paying out of pocket for that, that is expensive. I mean, it's crazy and it's ridiculous that our life is dependent on that, you know, is the cost. There is no cost on a human life. It should just be out there, you know, available for everybody again, you know.
Yes.
But the thing that is important to know is we brought up Jen Simmons. Jen Simmons is a surgeon. She's a surgical oncologist. She
Right.
has breast cancer herself. She is not talking out of her, you know where. She
Right.
is really fighting this. She's taking this to the hill. She goes, I know, she goes, to think that I was suggesting to women to go have mammograms. Oh my gosh. She's going to fight this even more. And I think it's really important that as I was reading the, you know, the MQSA and then what the U.S. Preventative Task Force is doing also, it's not enough. It's a bunch of words, but it's not enough. You need to ensure that this is available for everybody. And is it? Well, I guess I'm going to find out. I want to ask. I want to ask these questions, and I want to know how come if it's an FDA regulated by the government and by this task force that is put together, I want to ask that task force, how come, and it says we updated it in 2024, that every facility that does mammography has to have, you know, it has to abide by these rules. Everybody except the VA, the Department of Veterans Affairs. Now, why is that? I'm sorry, it really rang true with me because I'm a veteran. And you mean to tell me that if I go there, that if I have a mammogram that's not even regulated, I don't have no idea how much I'm being blasted radiation wise?
Yes.
Oh,
Yeah.
then this is not true. And what they're doing here with this report is not true. And I really want to bring that up. And I think I'm going to bring it up to Jen. Sorry, I
Yes.
started on my soapbox there, but it's yeah. No,
Yeah.
it's not right. It's not enough for women.
Yeah.
You know,
We
so.
are, as a woman, I think we have to start making those changes with us. We have to fight. We have to fight with the system ourselves. We should not just blindly agree what we've been exposed to. We just, each of us, when we go to the doctor and they've been offered the mammogram, we have to fight to go to and get, you know, the ultrasound instead of getting mammogram. So that's the fight. You know, we can start fighting by individuals, you know, ourselves.
Yes.
That's like, right?
Yeah. And the thing to remember, we have choices. You know, we have choices. We have a choice to go into that doctor's office and say, you know what, I think you're blowing smoke because this is why. And bringing those in there to them and letting them know. Because sometimes, honestly, I don't think they do know. Either they don't know or they choose not to know. And that is not good either.
Yeah, right.
So, and it's important to, you know, to arm yourself, I guess, and just do your due diligence and do the research. And that's hopefully what we're trying to do here is just provide a whole bunch more information and yeah.
Right. And
information is key. Information is key. 15 years ago, one of my best friends her mother had passed from breast cancer, and her sister had gotten breast cancer, and she got tested for the BRCA gene and carried the BRCA gene, and she went in and had both of them removed and was reconstructed with just knowing that she had the gene. I was
Yes.
like, wow. But then you're always going to have those people that are, oh my God, get it out, get it out, get it away, you know.
Yeah.
But
Yeah.
really have to be conscious of
Yes.
all the decision, all the things that are out there, you know, and not be so afraid. Don't be
Yeah.
afraid.
Yes.
It's
Because your
the
body
fear.
can heal,
Yeah.
you know.
Yeah.
But
Mhm.
Yeah.
Yeah.
We totally,
Yeah.
we
And there are
totally
so many
agree with
great
that.
ways to heal. So many great ways to
Yeah.
heal.
Yeah.
You know,
The option,
there's
the
a
best, exactly. We have a best
communities out
options.
there.
Yes. Yes. Genes are not, you can manipulate your genes. You can
Mhm.
repair your genes.
absolutely.
Just because you have a gene mutation doesn't mean that it's going to take your life or you're going to develop cancer. That's one of the things. Number two, there's a better options than the mammogram, their tomography, their MRI, their ultrasound. You can fight the ultrasound. You can, if on the worst case scenario, your doctor is not agreeing and your insurance is not covering, you can find a private, ultrasound place where you can go ahead and pay $200, $250 and have that ultrasound, because your health does, there's no price on your health. I understand like it's hard financial for many people, but destroying your health, it's gonna cause more financial burden. Right. So that's a best way of approaching your own health and going forward. Just all of us individually, if we fight the system, then the system is gonna change. Right? If we are going to continue going with the system, we're just going to take advantage of us.
You're so right. And I
Gotcha.
think that that's why it's really important that we all arm ourselves with as much education and information as possible.
Mhm.
You become your you have to become your own advocate. But if there's enough of us that group together to be able to help share that information, then yeah, change happens.
Yes. Yeah, definitely. And that's the thing, arming yourself. And, you certainly do have us, as far as when it comes to arming, we have your back. I mean, we certainly are, here to help in any way possible. And again, and everything changes and everything, there's a lot of information out there and we're learning as well. So, and as we learn it, we will bring as much as we can to the forefront to help anybody that we can.
Maya, can I ask you a question? Because you've
Yes.
had a little bit longer experience in diving into this than some of us. What have you found has been the most construed information that people have about breast cancer, screening for breast cancer, and prevention of breast cancer that's out there? That we might view in one way without the information. I mean, I guess mammograms, getting even started. I worked in healthcare, and I thought it was like 40 or 45. You start getting your mammogram. That was just like a requirement. You go every year if you have, family history of it. If not, it's like 2 years. But come to find out, according to that you had read off, Deborah, it's like what, 50 years, and every 2 to 3 years. So it's not even
Yeah, from
falling in
age
line.
40 to 74, it's not falling in
Yeah.
line.
So what are you finding that is like the biggest kind of a mess, I guess?
Oh gosh, it's a mess from everywhere. Number one, insurances makes doctor push the patient to basically to the stage when they're going to start taking action. Like telling patients, if they see something, they would say, okay, let's wait 6 months and we'll recheck it in 6 months. And we're so happy right now. Oh, right now I don't have anything. That doesn't mean you don't have anything. You should question that. Let's wait 6 months. Why do you want to wait 6 months until it's going to go to the point when it's going to be harder to reverse it? That's one of the biggest things. Like I wouldn't want to wait. Like if there's something suspicious, take care of it right there, right then. That's another thing. And like self-exam is the best way of going it. Like do like once a month or whatever, like just do your self-exam. And if you feel something suspicious, go to a right place. Go to the doctor. If your doctor is not agreeing with you, then find someone else who are going to be on the same page with you. go
Mhm.
to integrative or go to other, other
Mhm.
form of physicians who is going to listen to you. Remember one thing, you're hiring a doctor is not hiring you. So you're paying the doctor, even though you're paying, the insurance is paying, but you're paying for insurance, so you're paying your doctor. So those are the things. And the second, and of course, your lifestyle, your diet, your mindset, your stress, everything matters. You have to learn how to change everything. Like Laura said, like when she had a breast density and a little lump, she came home and what she did, she took an action, right? She put castor oil. Yes. She
Yeah,
put
you don't
castor
sit
oil, she
back.
got
It's like,
iodine.
what?
Don't sit back.
Yeah.
Don't sit back and don't wait
Ah.
until it's gonna go to the point
Yeah.
that it's gonna be hard to reverse it. So you gotta, and never ever take an action out of fear. That's another most important part. So always go, you have a time, to think, to do your research and take it. Going back to castor oil, actually, I did not have a client who did not have a success with castor oil. Just as simple as that. So it's a very good thing to do, to put on the breast. And of course, we cannot say cure or healed and stuff like it.
No.
It's a word we cannot use, but people do have a positive, response to castor
And there
oil.
are very strong essential oils that you can combine with castor oil. Castor oil is an incredible carrier that you can use
Right.
also, which is, yeah.
Yeah,
I
it
swear
is a
by it.
carrier.
I used
Yeah.
castor oil, coconut oil, and frankincense because I had, colon cancer. I
Yeah.
use it on my abdomen and my feet every day.
Yeah.
I
And it
just
smells good.
Everywhere. Yeah, everywhere. I mean, like that's another thing. You gotta try. You gotta do your research. You gotta contact people. You gotta just read. I mix castor oil with many different essential oils with different things.
Mhm.
I use castor oil all the time for so many different, So that's what I'm saying. Do not wait. Do not push it to the point when it's gonna be. If your body is having a symptom, there's a reason, to change something. Because it's coming from somewhere, and that something needs to be changed so it won't go into something nasty. So that would be probably my a short advice.
I guess that's a really good point. Like, if we're already going to get imaging done or even screening done, we probably already know that we're doing some certain things in our lives that we need to probably change. Because
Right.
even if we get that imaging done or whatever, no matter what it says, there's stuff that we're going to have to address that maybe we don't want to, like the way we're eating, our stress levels, relationships. I mean, like what we're
Right.
choosing to watch or be around. I mean, there's a certain thing. So it's kind of like that, like, well, if we're going to go get that screening done anyways, what do I really need to be watching for myself?
Right. Yeah. Okay, so it's been an hour of our discussion. I hope like we kind of help people to get a little bit thinking done here, do homework, and to change. And as we said, that we decided to do some this sort of discussion on a weekly basis to bring the awareness about different things that mainstream media, I mean, medical system does not talk about, but we are as a cancer survivors that what we did go through and we learned hard way, and we just would like to bring the awareness and make people think, So that's what the whole purpose of this discussion, just to help everyone, Okay. I'm just gonna stop the recording right now.
Happy St. Patrick's Day.
Yeah. I got nervous at the beginning.